Welcome to End of Life University on YouTube. Today, I'll be sharing with you a conversation with two guests, Dr. Sammy Winemaker and Dr. Hsien Seow. I interviewed them last year about their book, Hope for the Best, Plan for the Rest. And today, we're talking about their new workbook to accompany Hope for the Best, Plan for the Rest. It's a fantastic workbook, a great resource to have on hand for people who are facing serious and life-limiting illness. So I highly recommend you listen to this interview. It'll be very valuable for you, and get the workbook, particularly to pass on to other people that you may know who are dealing with illness, or for yourself if you need that. Maybe for the future, who knows? So stay tuned. I think you'll really enjoy that. Make sure you've subscribed to this channel down below. Also, subscribe and leave a rating and review for the podcast wherever you happen to listen. And go to eoluniversity.com/support to find 3 different ways you can make financial contributions that will help keep this channel and the podcast on the air. On my Patreon page, which is one of the 3 options you have, I have a brand new tier for supporting the podcast called Soul Supporter, SOUL, Soul Supporter, for people who are interested in my more spiritual content that I generate. And those particular patrons will receive extra bonuses and content related to the kinds of spiritual things that I enjoy talking about. So if you like that and you're interested, go to patreon.com/EOLU and look for the Soul Supporter category. And now we'll move on with my conversation with Sammy Winemaker and Hsien Seow. Today, I'm very happy to welcome my special guest, Dr. Hsien Seow. Hsien is the Canada Research Chair in Palliative Care and Health System Innovation and a professor in the Department of Oncology at McMaster University. He publishes healthcare research focused on evaluating healthcare policy and improving the patient and family experience for those facing serious illness. He teaches design innovation for health system challenges. And he, along with Dr. Sammy Winemaker, who unfortunately wasn't able to join us today. They are co-hosts of the Waiting Room Revolution podcast, a podcast to unlock the keys to a better illness experience. And they're also co-authors of the book, Hope for the Best, Plan for the Rest, 7 Keys for Navigating a Life-Changing Diagnosis, which we talked about, I think, last year, or was it the year before? Time's gone so fast, on our previous interview. And you can learn more about their work at waitingroomrevolution.com. So Hsien, thanks for joining me today. And I'm glad you're here. I'm really sorry Sammy couldn't join us.
Yeah, thank you so much, Karen, for inviting us back. And yes, unfortunately, Sammy can't join us. As maybe people might know, Sammy is a palliative care physician who works in people's homes. And so one of her home visits has run over, and so she can't join. She's with the patients. But I hope that I can represent our work. And I'm so glad to be back on your podcast because you have such a great community here and so many amazing people doing things all around the world. So thank you.
Well, thank you. And I just wanted to mention, I mean, it's been a number of times when I've done interviews with people, but also just met people in general. They have actually referenced your book, Hope for the Best, Plan for the Rest, as being very helpful to them as they were navigating their own illness or the illness of a loved one. And so I'm really excited to see that because it is an extremely helpful book, and I want to see it in everyone's hands. And so I'm excited to think it's getting out there in the world.
Yeah, I mean, we are, Sammy and I have been so excited to, of course, we love it hearing from people who have read the book, Hope for the Best, Plan for the Rest, which we talked about before. And when we hear people say, that it's been helpful and empowering and helps them get unfrozen from sort of just getting stuck in just, that whole fight mentality or not knowing what to do, we often also get a lot of questions, common questions about what to do when they actually start to interact with the healthcare system. And so that led us to create a workbook. People asked us these common questions, which we answer in this workbook, but also exercises to help them. And that's what I'm really excited to talk to your audience and to you too about today, about this 7 Keys workbook, which we created because the users said they really wanted it.
Yeah, I've been going through it myself because it is really helpful when you're looking at even just aging and things changing in your life and you're dealing with maybe new health issues that you didn't have to worry about before because it asks really important questions, but it also lays out a framework and a strategy for how to navigate it and how to go through this process of thinking about it. And so I'm so excited to be able to tell the audience more about the workbook and encourage people get the book and the workbook both. Read the book first, but then the workbook is just very handy to go through because you can actually write in it and record your answers.
Yeah, I mean, just a reminder, listeners, like, our first book really covered 7 keys to navigating a life-changing diagnosis. And I was thinking the other day of what is really different about this is that it's their actions and it's a roadmap. It really leads to behavior change is what we are really hoping for. It's like a mindset or a roadmap. And the 7 keys, for example, are things like learning how to walk 2 roads, which is the title, Hope for the Best and Plan for the Rest, but also to zoom out, to know your style, to customize your order, and know that you can make your priorities known. The ripple effects is the recognition of the inner crew and the family around you, knowing that you need to connect the dots and to invite yourself and bring your voice forward. So those were the 7 keys. Um, but how to enact them and actually exercises to help people go from reading and learning to actually doing was what the intention of the workbook was. And it took us a bit of time, but we were really excited to come up with original exercises. And they're very simple things that would take people from contemplative to actual action, and people have found these exercises really useful. They're very simple things you can write like in a journal, but to start the conversation with themselves, with their families, and of course with the medical team. And these exercises can be done individually, but also, in groups or to be discussed. And that's what broke the ice because it led to different conversations than the usual sort of, do you have any questions? And no, I'm good. Okay, see you next time.
Yeah, that's really good. I noticed for each one of the keys, you have a frequently asked question section, and as I read through those, I thought, wow, it's actually a wealth of information in the questions that people ask because it tells you where people are running into obstacles and roadblocks as they try to make change in how they're navigating illness. And there's so many places where people do get stuck, and the workbook itself can help people pass those obstacles.
Yeah, I mean, we're really excited because the workbook is actually very thin. It's something that, is like a journal or a notebook that you can bring along in your purse or in your bag. And the frequently asked questions, like an example of the inspiration of how that changed exercises was often people don't know how to talk to their clinician, and they are getting stuck with, well, I keep running into this common barrier of say, oh, they don't have enough time, or they're too busy, or I'm scared to bring my voice up. And so we sort of, one of our exercises is totally focused on sort of, in a way, sort of diagnosing what you think is happening. And the script, we give some sample language that you can use to try to sort of diffuse that or get ahead of that and invite your doctor, call out what you think is happening. Hey, I know you don't have a lot of time today, but can we set aside a specific appointment, or can we make a booking at the end of the day where we can just answer a couple key questions that I have about the big picture of my illness? I know today may not be the best time, but can we do that? Are you willing to do that? And these are strategies that we know work that really help people to sort of train their doctor or give permission to their medical team to enter these uh, into these important conversations that are better done early than late.
And it's important for us to point out that there are gaps in our healthcare system, and part of it comes from a lack of training for healthcare providers, also a lack of time, as you said, and sometimes just discomfort about talking about difficult things. And for many healthcare providers, it's easier to focus on hope and talking about one more treatment or one more clinical trial. We can find hope in that. There's something we can do. And those clinicians have a hard time recognizing that if we talk about these challenging issues, that's actually something we can do. If we actually give people the keys to help them navigate what's happening emotionally, and make choices for themselves, that actually is something that's hopeful for patients.
Yeah, it's so interesting. I mean, to share something personal, like in my own family, it's happening now. And, the medical part, people can wrap their heads around, like we need this treatment, let's get access to this trial or this study or this test. But it's the emotional part that people we're not trained to do. And it's actually something, it's an individual journey and requires a lot of complexity and tenderness. Um, and even people who work in hospice palliative care their whole life, like they are helping other people. If when they face it themselves in their own family, they say, I was prepared for the medical part, but the emotional part, I was not prepared for that. And so you're absolutely right. Like we cannot underestimate that this is such a human experience, and yet we don't have training as people, not just the medical system, but as communities on how to do this. And I think that's why these scripts, these information, these exercises can help people to seek out resources, support, and find the language so it's not so scary. We can talk about the experience without talking about the death, because that may not be where everybody wants to get into the dying part, but there's still the living part. And it's such a fine balance, but really, I think when I look at the whole of the work, it's really a focus on the living and bringing the person's voice forward and making use of the time we do have rather than focusing on the time that we're losing.
Yeah. And I wanted to say this framework, it's helpful for patients and clinicians alike. Like clinicians would really benefit from reading this so that they had an understanding of, oh, this is how I could approach it, and some things I could say to patients if I want to bring it up. But even if the clinicians don't know or aren't comfortable, if a patient walks in and they're carrying this book and they turn to a page and said, here's what I've been writing in my journal, here's what I've been reading about, I think that will really help the healthcare provider, who will maybe feel a relief in a way. They don't have to bring the topic up initially, and the patient's already guiding them using this book as to how the conversation might unfold.
Yeah, in a way, it's like having an insider who can coach. It's like a coach. It's having a coach. The workbook is helping coach people on what to say and what to do so that when they enter into this foreign medical system, they have a leg up in terms of knowing how it works and ways to anticipate the common roadblocks. And so it might be helpful if I just, as you were sort of alluding to, in each chapter, we start off with a reflection, which is like a journal question that is not related to health really, and just to allow people to just sort of enter into this space, not talking about their own situation but about their own life or their personality or their experience, and it's a little journal prompt. Then we reintroduce the key very quickly, and then we give a couple exercises that are born from our users who said, I really wish there was something, help me with this piece about it. And so, for example, zooming out, which is about getting the big picture of the illness. We actually had 4 or 5 exercises because that was the most meaty thing in step-by-step pieces from, slowly each exercise kind of builds on the other and you can start and stop or skip exercises, but just to help people reflect or engage in conversation. Some of them are have this conversation with your caregiver, or think for yourself, or fill out the sheet and bring it to your healthcare provider and have a discussion. So for about a handful of them, that key exercises, we actually had a QR code because we knew it was so important and that people would want to revisit it or print it out, and it would change over time. And so we've done that. And then it ends with, as you said, the frequently asked questions for each each chapter. And they are also came from all the talks we've been doing where we hear many of the same questions, so that people can learn from others and we can, get farther ahead and sort of getting stuck in the same places.
Mm. Yes, it's just so helpful to think of an illness in this way. And a person I interviewed recently told me her husband had Alzheimer's disease. She used your book and your strategy and framework through his illness because it really helped her understand where he was in the stages of his illness and what to expect. She said it made all the difference for both of them because they could talk about it, and understand where things were and know how they needed to prepare in the future. And that kind of knowledge is so important and so vital to us when we are navigating something serious, but when also our time may be limited and we want to make the best of things. And one thing she mentioned was making decisions about, should we want to go visit this one person and take a trip, when should we do that? And looking at the timeline and that big picture helped her see, we need to go right away now if we want to do that. That's something we shouldn't put off. It may not be possible later, but I just think of how valuable that is when people are trying to make life decisions and plan for how they want to live in the near future.
And that's the stuff that people remember, right? That the survivors, the grief that helps us to, transverse grief is the good memories. And that's what we want to hold on to, not the things that are suffering. But the time that we do have and the way that we want to be remembered and to live. And that's how we make meaning, for all of us. Thank you for sharing that, because like that's why we sort of are doing, trying to create this revolution. And I think I wanted to mention that it's beyond our book and this workbook, the website Waiting Room Revolution. We have a lot of free tools and resources that
Mhm.
maybe some of your listeners might be interested in, like free one pagers. And we have different roadmaps for different illnesses. So we worked with the Alzheimer's Society of Canada. We've worked with the ALS, the International Alliance, to create a roadmap for ALS. We've done one for ovarian cancer, for COPD, and heart failure and renal is on our list. And we're trying to work, and I think there's a great opportunity to partner with many different organizations and patients and families. These were all co-designed with clinicians and patients and families of what they wish they had known at the different stages in one page, just to be a starting point so that they could know that there is a roadmap and there are chapters for every illness, and it shouldn't be a surprise. And what you do with that information is up to you, but it flags the symptoms and the physiological changes I should expect, but also, therefore, what should I do to prepare? Like if you might have some cognition loss or that's affected, well, we need to start planning for, your power of attorney or your financial things before you lose capacity to speak, or things like, or ovarian cancer. They talk about reproductive rights and fertility early before, treatments happen, and that, some of that gets lost. So those were things that patients and families talked about that were so important that people don't think about, and then it becomes too late and they regret.
It's so true. And I think there's really value in hearing, this is what people who've walked this road before have told us that they wish they knew. And even the person reluctant to dive into too much information might hear that and think, I should probably know what that is, because these are the people who are actually here where I am in my shoes. And I should know what it is they said would have made a big difference if they had known it now.
I mean, that's the power, right? And that's why um, our work, we really tried to frame it and continue to frame it as a revolution. It's a social movement. And I know when we were on your show the first time, we had people from all over the world write to us and join our movement. But we continue to have people join because this information belongs to the people, belongs to in every community, patients, families everywhere. This isn't proprietary. These are the strategies that thousands and thousands of people have walked this road before and wanted to share with others. And so we feel like we're sort of have the responsibility to take that knowledge and to try to share it and give it away in many different ways. And that's why maybe this is a good time to bring up, but we actually, with our workbook, have a like a workshop toolkit. We called it the workshop in a box, and it's part of our ambassador program. We call them ambassadors, people who teach this the workshop. But basically, we created a free downloadable workshop that goes with the workbook and book so that people can download it and adapt it into their own communities, but teach others. Because I think there really is a global need for this and a global community of people who are trying to change the patient experience and recognize that activating patients and families is a great strategy to help really to support healthcare providers, but also to change the system. And so that ambassador program is available on our website. and you can download the materials for free and just, join that community, and you can learn from each other. Really beyond what Sammy and I can do in our where we've been traveling is we meet so many amazing people who are doing great things, and we can learn from each other.
Yeah, that's really fantastic. And I wanted to emphasize you don't have to have medical training to be an ambassador or to lead the workshop. And I would love to think that people who have maybe training as an end of life doula would want to also become ambassadors because they might be in a community where they're struggling to find enough people who are ready to embrace the doula movement and to hire someone to be an end of life doula. But this is where it needs to begin. When you begin by educating people and helping them navigate a serious illness, you're almost preparing them when they do get reach a point where they're ready for a doula or for hospice and palliative care. It'll be easier for them to make that choice if they've been educated in advance. So this seems like a really great fit for someone who has a practice as an end of life doula.
Yeah, I think, as you know, people misunderstand what doulas do. And so, as part of the toolkit, we have a facilitator guide, which is really short and, almost like a magazine, but we give different options for how someone might teach this workshop, whether it's 1 hour or half day or as a book club. And we did think that, some of the ways to position this or to market this so it's not so scary is like how to be a patient, or what caregivers need to know. Because there are things about advanced care planning out there, and there is stuff about preparing. You don't want people to think it's about preparing for death again. It's about living well. And doulas, and not just doulas, hospice coordinators and educators and volunteers, and even support groups and cancer support groups, or all different kinds of disease support groups. There are so many activated people out there who want to make a difference, and this is a way that they can um, get materials that, and of course adapt it and take different parts of it and that they think are relevant for their community. But we, from our experience, the language and the tools are upstream, and they are about living and not about dying. And so that's why it resonates. And I think it, in a way, might even lend credibility to your community, because now they've met you if you're a doula, or the hospices also have the same issue. People think hospices are just end of life, but actually they have so many amazing resources and programs, and people have just don't know until it's too late. And so that's what we hear so often. And I really hope, this is the beginning of a revolution. Obviously our keys and our workbook and the workshop are just a scaffolding, and you can infuse your own flavor, your skills and resources and tools, and the local programs you have. That is the goal, is to allow it for not us to be the star, but for the educators, the facilitators, to be the resource in their community. And of course, there are other programs and resources and tools they should connect to. But again, how do people find them? They have to first start with knowing that there is a framework on how can I be the most knowledgeable and activated I can be, and I'm not actually hopeless and helpless.
Exactly. And I've had a lot of conversations recently with people in palliative care and hospice care who feel like we need to rebrand these specialties just because the public has kind of a darker image of the work they do, and the public doesn't equate it with how to live a better life and enjoy all the life that you have and make the most of it. But this curriculum, as you said, because it's hope, hope for the best, and the curriculum is all about that. It's a perfect addition, and once again, the dying will happen. The dying will come up eventually in its own time, but this is a perfect way upstream to help people start preparing to live the life they want to have within the confines of whatever their diagnosis is.
Yeah, and I think we really felt like that was a big signal, because we've had people who don't have an illness that will is life limiting, but is chronic or progressive, and like mental health or intellectual development disabilities or various different conditions, and they have said these keys work for them, even if it's a cancer, for example, that's curable. You still want to have the best experience, and while you're getting treatment and stuff, it's still a scary and complex system to use. So in a way, you know, if we're teaching people or coaching them on how to be informed, activated, empowered patients and families, that is going to help them every time they interact with the healthcare system. And of course, that's never more needed than when the illness is something that will, lead to a death. But that could be many, many years from now. And we don't want to save all the good care, compassionate, relational care for just the last weeks and months. That's something we all deserve right from the beginning. And again, as we've talked about before, 95% of the care is provided by the family and the community. So in a way, this isn't just about doctors, nurses, and the medical team. It's also about tapping into your community supports.
Yes. And I wanted to say too, if there's someone listening, if you have a loved one dealing with a serious or life limiting illness, it isn't just that you should buy this book and give it to them. You may recognize they're not ready for it, or they won't know how to deal with that. It's for you as well. It's for the loved ones and family members, because you talk about the ripple effect and how any illness has an impact on everyone in their circle of care. And so a loved one could go through the workbook on behalf of their of their person who's dealing with the illness and gain so much from it, but also learn some tools and tips for how to bring up certain conversations when the time feels right.
Yeah, I mean, a perfect example is one of the exercises we do when we talk about know your style is we created like a personality test kind of. We have about maybe 8 dimensions that we knew or themes that we knew really change were really important for for when people face an illness, like their sense of privacy, like how much information do they like, are they sort of future gazing, and we sort of have people rank themselves, and then we sort of interpret that because we're all different and there's no one right style, but it's helpful to know what the patient's style is, what their caregiver or family style is, and how that's going to work together. And so that's just an example of the exercises we have. So that people can, what they're going to expect. And my favorite thing is at the very end, in the very last chapter, it culminates. We sort of the key, like the summary for each chapter and put it into a one pager. We call it the My Big Picture. And I'll just have a handout here, but it looks like this. You can't really see it,
Mhm.
but it just summarizes the 7 keys onto one page, kind of like if you were going for a job, to apply for a job and you handed in a one-page resume. This is what we hope people can, if they go through the workbook, can hand to their healthcare team or even to their families and say, this is who I am, this is what I understand about my illness, and this is how I want to walk this journey. And I invite you to do the same, and it helps you understand my style, what their priorities are, how much they want to know about the big picture of the illness, who is important in their family, all of that summarized in one page. And I think people who have used it have said it's like, it has changed the conversations fully because now the healthcare team knows where to start and they can enter, a lot of the mystique and worry. The elephant in the room has been named and they're ready to talk about it. And it kind of takes away all that pressure of, oh, I don't know if they want to talk about it. No, they're giving you permission and they've written it out in the summary. So we hope that it's very practical, the workbook. It complements the book with the concepts, and it can lead to deeper, more relational care.
And I just love it. It's like the ultimate in productivity. If you can sum up all the work you've done in the workbook in one page, that is extremely valuable because every nugget on that page is going to have something really powerful behind it with all the work you've done. But how helpful is that to make copies of it and give it out to your children and your physician and the people in your circle of care so everyone's on the same page and they understand what you're thinking and what you're dealing with.
Yeah, it's a game changer because it's role modeling. It's giving permission to those around you to talk about it, to help walk in the same, to take on that role with you and not be scared to talk about it. I was just on a call this week. Sometimes my name gets passed around and people call and they're like, well, my sister, I know she's dying. She had a brain cancer, but we don't want to talk about it because it will be sad. And it is, of course, sad. But, if his sister had given permission and said, actually, this is what I know, this is how I want to walk the road, it would have invited different conversations and not everyone's walking on eggshells. It's sort of this cone of silence, so to speak. So the one pager has been so helpful for people to articulate, and also as a signal to the healthcare providers of how activated they are and engaged they are, so that they know that they're working with this kind of team, really, and that you're really signaling, hey, healthcare providers, you're joining my team, me and my family's team, not, we're going to contort to join, the healthcare system's rules. Like, we want you to know about our family rules and how we want to play this game and live out this part of our life. So we found that really helpful. And again, a conversation starter, but a game changer in terms of the kinds of conversations that they can have, and the way that they're making choices in these months and years, maybe.
Yeah, and I would imagine this framework would be so helpful for caregivers. We hear all the time about caregiver stress and burnout, and it seems to me that this is a tool for caregivers to at least assess what is happening, because some of what must be so stressful for them is having no idea where is my loved one in this process, how long will this be, what do I need to prepare for, how long will I be serving as a caregiver, and not only that, but all the other issues that come with it. It seems to me this is one of the ways we can help alleviate some of that caregiver stress and actually make it better along the way.
Yeah. So, like, I'll give you an example. So, like, one of the exercises again in that zoom out is help me ask the right questions. So we have 5 questions that we have tested and co-designed with patients that either patients could ask, but caregivers should know the answer to as well. So an example is, where are we now in the big picture of this illness? What can we do now to be as well as possible? What are common signs of the illness worsening? What are important things to prepare for next? And what organizations and resources can support us? And so these 5 questions are, again, not about dying and death. They're about living and preparing. And caregivers can absolutely use the workbook independent. If the patient is not ready or is not the kind of person who likes information and is day to day, caregivers can get the workbook and fill it out and go through it, because they deserve this information too. And where there are gaps, that's definitely a signal so that they can ask the healthcare team to be, I need to know this because I'm the one caring. And again, 95% of the care is being provided by me and my family. So we need to know. And there's lots of other exercises that help give them ideas for practical things they should prepare for, and not just physiological things, which I think you can find online, but the practical things that patients and families said, I didn't understand this meant that I needed to do these things and get
Mm.
these things ready, or research about this and that. And also how to also make sure they're taking care of themselves. So we have some exercises focused on respite or the conversation. We use the word negotiation, I think, or invitations, but there is a discussion that needs to be had with caregivers and patients about, what am I able to do? What are you asking me to do? What am I willing and able, and where do I need help? And where am I not, where I think I'm worried? And that changes over time. So we encourage, and some of the tips that we provide are about, how do you revisit this? Because illnesses progress and change and lots of things happen. And these are all signals for the patient to give permission to the caregiver as well, to say, hey, I want you to be well too.
Mhm. And even I was just thinking, there's a big difference if you're dealing with a 5 month process, a 5 month road, or 5 years. And for a caregiver to know, you know, I'm likely to be giving this level of care and more for the next 5 years. To think of that now and think, what will it take for me to be able to sustain this for 5 years? What kind of help do I need? Who is going to need to come in the next year or so to help me out? How do I get that in place before I'm in a crisis situation?
Thank you. Yeah, you're absolutely right. And, where we hear the stories where there's the most trauma, I think that's a fair word, is for the caregivers who didn't know this was happening and slowly, piece by piece, lost themselves. And for the long-term caregivers, this is where they really, their health deteriorates, but so does their identity and their
Mm.
and so many things occur. And if we look back and they knew that, they probably wouldn't want that for the people they loved most. And so actually in Anticipate Ripple Effects, and that's one of our keys, there are exercises about it's mapping the ripples. That's one of who is in my inner crew, who is in the first, second, third ring, and what are the responsibilities. And then we also map out some of the key caregiving roles. We actually looked at a lot of literature and research about different tools that exist and tried to simplify it into like a one pager about some of the key roles, like who's going to do the cooking and cleaning, and who might do personal care, but who might do the finances, and who might do the social support and emotional support, and whose name should go there in your looking at those ripples in the inner crew, and where can I use my first ring or second ring, my community, my friends to support and check in to make sure that one name, that primary caregiver, isn't listed for everything, or the daughter, is listed on everything. And that's, if you really think about it, that's not sustainable for anyone. It's not healthy for anyone, and it's not the impact that we'll have. Um, is really quite important and big and not to be underestimated. So some nice exercises, again, very practical ones inspired by real life and real experience that we hoped would bring attention to these really key issues, but also help people get ahead of it.
Yeah, that's just so valuable and so practical. I was thinking of how we look ahead and forecast, oh gosh, in the next 10 years, there's going to be a caregiver shortage. We're going to be in trouble without a caregiver. But knowing that, that's our roadmap that we have to deal with in terms of caregiving. Let's start implementing tools right now that help people who are caregivers so that we have a really good process to keep caregivers healthier and to help people who might make good caregivers if they knew, if they had this information and knew how to prepare for it.
I mean, I know you'll agree, but the number one thing we hear from caregivers is they're like, I don't identify myself as a caregiver. I identify myself as a husband, a wife, a daughter, a son, and that label doesn't fit me. And so this work about the waiting revolution and going upstream is about helping people see that even if you don't use that label, you should be activated as a family member. Um, because you're in the inner crew. And then it's to recognize that resources in my community exist. I mean, there hasn't been one place that we haven't visited in the world where there are community resources. Now, there is no perfect system. There hasn't been one, perfect community. But there were lots of really great programs and lots of really great help people that really cared. And in a way, we had to help people to see that um, asking for help or accepting help or learning, being supported by others like support groups or hospices or even organizations like Meals on Wheels or accessibility services. These are connected not to dying but to living, and that is a palliative care approach. Palliative care approach is helping you live the best you can for as long as you can, and so anything that's helping you live well and enjoy life is, in my opinion, connected in the sphere. And so the sooner people appreciate that an illness will progress and understand what that looks like and tap into their community, that is the public health palliative care approach. And that communities have always helped people, navigate this chapter of life, this natural chapter of life. But we've lost that over time and we've over medicalized it. And so I think one of the things that can help caregivers is if you don't identify that label, that's okay. But know that there are resources, and the sooner that you think about what you need and who you already have and what things you need to complement what you're missing, the better off you'll be. It's not going to be easy for sure, but it will be better than if you didn't do it.
Yeah. Oh, that's so very true. Well, it sounds like since the book came out, you and Sammy have done some traveling and you've been able to visit communities and talk with people. How has that been for you?
It's been so fun and really it keeps you going, because it's inspiring because we get this question a lot too. It's one of our FAQs in the book, but how do these seven keys uh, relate in different cultural, religious, spiritual contexts? And what we have learned is even though the language might change a little bit, the concepts are still the same. Certainly the fear of death and dying is pretty universal in most, almost all countries, or at least, the over medicalization of it. But I'll give you some examples. So, like, we met someone in the Philippines, um, and she said, well, it's a very religious Catholic country. So we say, pray for the best, but plan for the rest. And that allows people to know that they can still pray and hope for a miracle, or what they would consider, the path from God, but they can still plan. And another version of that is we talked to Dia Martina, who is from Indonesia, and she's an oncologist, and she said we have a proverb that says, you know, pray to Allah, but tie up your camel. And so
Mm.
they the same kind of idea, like you can still have the spiritual belief and hope for the miracle, but you still got to tie up your camel and like be practical and know that you can't just trust in a higher being and everything will be okay. So there's different iterations of this. We've done it with First Nations communities, um, places in Australia, in Europe, and so there's something universal about the challenges we're addressing because the medical care has really swung, of how we've the Western system of medicine or the over medicalization of it, I've said. Um, but there is a global or international desire to bring the humanity back in care, to put the human back at the center, and to really go back to relational care. And that's what these 7 keys do, and the workbook helps people do, is to put the human back, to put the individual back, and to bring their voice forward, their uniqueness forward. Whether that uniqueness, we get this question a lot too about, different marginalized populations, and we say everybody is unique. And of course, there's structural barriers that we want to address, but these keys help to bring those forward. What is the most important thing I need to know about you? Don't wait to be asked that. And help your provider is trained in dignity therapy. Bring that forward. You tell them. And whether if that involves where you live or how you live and who you love, absolutely. On your spiritual needs, bring that forward. But not everybody, that may not be top of mind for everybody. So we let people decide. And that's the best care, when it's personalized and person-centered.
I really love the term you used, relational care, because I've seen many studies now showing that one of the biggest factors for patients in actually improving and getting better is the relationship, the interpersonal relationship they have with their healthcare provider. When that is a trusting, caring relationship, it seems to me patients get better and do better. They have better well-being when they feel cared for. And just the thought of that term, relational care, where we emphasize we just relate to each other as human beings who are going through a hard journey here on planet Earth.
Yeah, I mean, it's so interesting because what we hear over and over again is how many patients' families at some point can appreciate that uh, their clinicians, modern medicine cannot solve all problems, but they want them to be present and to be honest and to be care and compassionate, of course. So we can't change the illness, but we can change the experience. And they that just really stands out to me, that little saying, because I think people can appreciate at some point that their doctors are and nurses and healthcare providers are caring, but they don't actually expect them to perform miracles. But they do expect them to be compassionate and caring and empathetic and to listen and to try their best to help them navigate this complex system. And that's where the frustration comes in, when they feel like it's a cold system that, just for no good reasons has, they've just become a number and dehumanized. I think that's where, many back in the day when we didn't have all those fancy things, we were just, that is what the heart of palliative care started with. But of course, it's improved with more technology, and that's wonderful. But we've also focused really on the last days and weeks and specialized that. And I think we can go back and remember, pull the pendulum back, and remember the role for community, family, for healing through relationships and understanding. And this is what these last chapters, that's what people want to do,
Mhm.
mend relationships and say goodbye and find peace and closure. It isn't only about extending life.
Yes. And I love the idea of the waiting room revolution because it is a revolution in how healthcare is delivered, but it starts in the waiting room. It starts with the patients, the recipients of care saying, this is how we want it to be, and we're going to lead the charge, and we're going to help change healthcare from our end of the relationship. And I think that's really beautiful.
Yeah, I mean, of course, you've been doing this for years when you started End of Life University and trying to teach people about, this, how to do this well. And so like I said, we're just always finding new ways to activate people and build the community. But, we're calling people who join our revolution ambassadors. And when they become ambassadors, they obviously get access to the workshop in the box and the facilitator guide so they can for free and they can make it their own and teach it right away hopefully using our book and workbook. But they get discounts on the book and workbook. They also join the global community of other change agents. And so we have things like a WhatsApp list, an email list just for the ambassadors. We have a map project that we're working on so people can see on the map where people in their community are doing the same kind of work so they can connect locally and activate and learn from each other. And we would love to, in the future, have a conference, maybe virtual, where we bring people together and learn from each other about some of the common challenges, like how we reach certain, marginalized populations, or how we teach this concept, or what techniques work for doulas and this and that. So we would love to sort of build that community. And I think one of the things that the community can help do is we can work together to do translations, and we can work together to also change medical education, because I think that's another role too, right? To your point, it isn't just patients and families being activated. We need healthcare providers to be ready. And so that's on our radar list as well, but it's just going to take a bit of time as we grow. But I mean, I can't tell you how, and maybe you've seen it too, there is no shortage of books and people who want to talk about it because it's still relevant, maybe even more so today. And the urgency and the unnecessary suffering that's there, and the people who want to do something about it are there. And so this is a way to capitalize on that. And also not to feel that it's only healthcare providers who have to change. Like, everybody has a role in making the experience better. And in whatever ways that makes sense for people, um, they can host a book club, or teach one of these courses. Like you said, you don't have to be a healthcare provider. You could be we've had activated caregivers say, I'm going to create a chapter on my own, and I'm going to just start teaching this to other cancer survivors and cancer patients and families, because they need to know this. And so that's the things that we find exciting, that people are taking it and making their own in ways we never imagined. But that's what a social movement does. And that's how we're going to spread all the good work that people are doing.
Yeah, and I was thinking about when a healthcare provider and a patient have not had these kinds of conversations and talked about deep issues, on both sides of that equation, each person is thinking the other one is feeling a certain way or making assumptions about them. Patients assume the doctor doesn't want to talk to them about these issues, and the doctor assumes the patient wants me to perform a miracle. That's what they're looking for. And as you said, patients may realistically already no, there isn't going to be a miracle. That's what I need to talk about. What do we do without a miracle if the miracle doesn't happen? And if healthcare providers understood that and patients understood, everyone is actually kind of dancing around the same questions and the same issues. There's just some reluctance and discomfort on both sides about how to act, how to have the conversation.
Yeah, and I think everyone wants different types of information at different times, and I think that's fair to check in and ask. But we've actually thought of, for the provider side, to think of them as invitations. You're not disclosing stuff without people's permission, but each of these keys are like invitations for healthcare providers to, invite the family forward, to invite questions, to invite illness understanding, to invite their personality forward. So, for the healthcare providers listening, these 7 keys can really be thought of as invitations, as ways that you can ask questions, and based on their answers, you're going to know whether they want to talk about it or not. And rather than just avoiding it altogether, I think that's a key piece to that.
And you mentioned, so the worksheets that are in the workbook are, you have QR codes so they can be downloaded and printed. And then you also have the trajectories of for illness, certain worksheets on your website. Could providers print those and hand them out to patients? It seems to me like that would be really helpful too, if providers gave that information to their patients.
Absolutely. I mean, everything on our website is available free of charge. So the roadmaps, we have the 7 keys, our podcast is free. There's lots of free materials and ways that people have adapted it to are available, and some of our tools. And those QR code worksheets that come from the workbook, I mean, ideally people get them from the workbook, but we know that these things make their way out into the world and people adapt them, and we want that to happen. And so at the end of the day, if people understand that these keys are sort of a different way of um, doing really good person-centered care, then we want, that's how we want to learn, and that's how we're going to spread the revolution. And I think in a way, what we've realized is it's redefining what the population masses think palliative care is. If we call it that, people continue to think it's end of life, and it's not surprising because most of the time when they meet palliative care is when it's very close to end of life, meaning months and weeks. But I think when we really think about what we're looking for is person-centered care and relational care all throughout an illness. And these keys are relevant even then. And yes, they're going to be even more relevant when you are facing something that will be life-limiting and progressive, but they're also relevant for chronic illnesses and really anybody who's interfacing. And I think that's where the overlap really happened. And that's where the public really, that's what they want. They may not necessarily want if you ask them, they may not want a palliative care to visit, even though they really do want the care that palliative care providers provide. But the reality is, all of us have a role in supporting people who might face this journey. And it's kind of identifying that and just taking that on. We don't have to name it and agree on the labels, but we should try to focus on the doing.
On the doing, exactly. Well, I did want to point out you and Sammy are so very generous with all the resources that you're offering the ambassador workshop plan for free on your website that I want to know how we can support your work. I assume number one, let's buy the workbook and maybe even buy extra copies so we can give it away to people that we know who would benefit from it. Any other ways that we can support the work you're doing?
Yeah, thank you for asking. Yeah, on our website, Waiting Room Revolution, if people join our listserv or the ambassador program and download the stuff, this is how we'll work as a community. I mean, really, the book and the workbook is our main sort of vehicle to get our information out. But if you become an ambassador and teach it, we have, like we said, bulk discounts so that people can, and also, we know doulas and many people, this is their livelihood, so they need to charge, and so we try to make it as barrier free, as few barriers and lower our costs. And so there's lots of ways, but you can buy the workbook from online stores. That was one of the ways we could bypass some of these costs. And then our book is available in online stores, but also in bookstores. But yeah, I think really the supporting them is just really, joining the ambassador program and sharing how they're adapting it and using it and just spreading the word, because at the end of the day, it isn't really, again, about us. It's about the global collective. And I think the workshop has led to the workbook has led to the workshop. And I think it has now led to a global community, and we can work more closely together. It's again, not just the workshop that we're teaching, but the many things that are connected to that and the themes that are connected to that. And I think what's different than what's out there is it's not the medical stuff. It's not overly research, although that's one of the goals we're working on, is evaluating um, people who are doing the workshop program. We have some research that I'm leading that's looking at that. But we're focusing on activating communities and the public to take a role. And I think there's way more people in the communities and public, and has always been, than in the healthcare system, the formal healthcare system. And so that's what brings me hope. And I hope people who join as ambassadors feel the same optimism that Sammy and I do today. We didn't when we started. Our story is comes from pessimism, where we wanted to give up, and we're like, we can't just keep doing the same thing. Do we just give up? But focusing on the public and activating patients and families in this way through the revolution has given us hope. And where we go, we kind of, people are like, it's so great. You feel so good when you're doing the work, but also it's not just that end of life, and you feel regret that they didn't get it sooner. We're doing it early, and that feels so good. And we want other people to feel that way too, because it's tough work. It's really tough work.
Yeah.
Um, and so we want others to feel good and to be the stars in their community, because that's what, we're so honored that people see us as the face of this movement, but we know that can't change the system far enough with just two people. So we want to share that with others, the spotlight, and really that's where it belongs, on others, but on the patients and families and the communities.
Well, you've created something amazing here. And the workshop or the workbook, as you said, because it's actionable, something that is going to make a difference and make a change. Everyone should have this in their hands so that they can use it for themselves or share with someone else. But I hope a lot of people will consider becoming ambassadors and getting the workshop in a box because that seems ideal. Like there's so many people who would be great at teaching that workshop and they should be adding it to whatever it is they're already doing. And
Yeah.
I'm just so thrilled that you've made that a free resource to everyone. That's really amazing.
Yeah, and I'm excited to hear how people adapt it, whether it's for kids or for this community or that. I mean, that's what the workshop in a box is meant to do. It's the scaffolding for people to adapt it. And I think so many of your listeners are going to have amazing ideas, and we're just so grateful for the community you've built, which just has so much overlap with trying to create positive change in this field, so that people don't have to fear this natural part of life, but rather it can be. There is healing in it, there is a living in it, and there is hope in it. And that's what I think we're looking for.
Exactly. Well, what's the best way for listeners to give you feedback through the website or just becoming an ambassador and joining the community?
Yeah, either way, there's no wrong way. If they join the listserv, that's on our website, there's an email there. But if they join the ambassador program, waitingroomrevolution.com, all the information is there. Sort of and when you become an ambassador, there's sort of you can also email us, but there's a sort of a smaller group of people who are a subgroup, I guess, if you will, who are really, activated and wanting to teach this. And we want to bring that group together because they have really great questions of how to spread this and what they're doing on the ground that, Sammy and I are not at that level. So they have a lot to teach us in a way. And so that's sort of just our generic list. And we continue to do podcasts and stuff. So yeah, they can absolutely just go on our website and learn about the movement, and also where they can get all these free resources that we people have created and co-designed. And really, there's so much more to do. So we really want their help too, and their ideas of where we should go, but also what we can sort of co-create this together. That's what we're doing. We're sharing this with the global community.
Yeah, the waiting room revolution is really just getting started. So people can get in on the ground floor in a way and be part of shaping this change as we go forward.
Yeah. And that's why it's so great to be on this podcast to share it with your audience, which have so many great people. And some of them listen to the first podcast and they maybe want to check that out again, where we talk about the 7 keys more in depth. But this is sort of the next step, and you can see it evolving. And so we're just grateful to the listeners who are doing this work on the ground, but also, listening, who are trying to do more. That's how we're going to see change. That gives me optimism that we can see a difference in our lifetimes.
Exactly. Exactly. Well, I will link to our previous interview because I think that would be really helpful for people to go back and listen to. And then who knows, there'll be more interviews down the road, I'm sure, as we check in again on how the waiting room revolution is unfolding. So thank you so much for joining me and give Sammy my best. I'm sorry she couldn't be with us today.
Yeah, Karen, thank you so much for having us on again.
Thank you. Until the next time.
Absolutely.
Okay.